Hey again, welcome to Dr. Bret's office. I'm Bret Manasseh, and it's time for another edition of Dr. Bret's Mailbag. I take questions here from anybody interested in mental health, whether you're a counselor yourself, a student counselor, or in this case, a non-counselor who wants to run something by a therapist and university professor like me. All right, so here's a question from somebody who does not want me to use their name. I will respect that. He says, "Dear Dr. Bret, I've had trouble with drugs and alcohol most of my life. Every rehab tried to put me on psych meds, and I always refused because I didn't want to just switch one addiction for another. And I worried that if I started down the medication road, that I'd be on meds the rest of my life. Well, I finally gave in and started taking meds for depression, anxiety, and even for my cravings. I work a 12-step program, which I credit for my sobriety, and I've been clean for 2 years. But even in 12-step groups, people say if you're taking any meds at all, you can't consider yourself clean. So I'm asking, did I just trade one addiction for another? Am I going to be on these meds forever?" Wow, that's a big question. Thank you for asking that. You sound like you're building some really solid recovery. I'm glad. I'm not a medical doctor. I'm not a prescriber of any kind, so none of what I'm going to say is meant to be specific advice for you or for anybody watching this. Talk to your own prescriber if you want specific medical advice for yourself. But I will provide some general information, some philosophical context, maybe another perspective that you can think about. The first thing I want to address are the people who try to decide for you whether you're sober or not. It is possible that somebody in recovery could be abusing the meds that they're prescribed and lie to themselves about it. But that's not for anybody else to decide, even if they mean well, even if they're trying to help. To me, that sounds awfully judgmental and self-righteous. There's a 12-step saying, don't try to work somebody else's program. Your recovery is between yourself, your higher power, your doctor, your sponsor, your therapist. If you want to respond nicely to people who say you're not sober, just say, "Thank you for the feedback. I know you're trying to help, but I've got to work my own program and I don't want to argue with you about it." That might be a nice way to tell them to mind their own business. Next, whether you've switched one addiction for another. Ask yourself, is a person with hypertension addicted to their blood pressure medication? Is a person with diabetes addicted to insulin? I bet you said, of course not, but that's not the same thing. Well, I would say that they pretty much are the same thing. Someone with depression is no more addicted to their antidepressant than someone with diabetes is addicted to their insulin. Someone with bipolar disorder is no more addicted to their mood stabilizer than a hypertensive is addicted to their ACE inhibitor. Yes, all these people might depend on the medications to live a healthy life. But depending on a drug that helps you stay stable and healthy long-term is not at all the same as being dependent on a drug that, although it might ease some of your symptoms short-term, ends up swallowing your life. Depending on a drug versus being dependent on a drug might sound like a small semantic difference, but believe me, it's absolutely not. Why? Well, let's contrast drugs that get abused with drugs that typically don't get abused. How addictive a drug is depends on 3 factors. First, how quickly the effect comes on, how intensely the effect is felt, and how fast the effect wears off. And you can guess that drugs of abuse come on fast, hit hard, and wear off quick, which is what makes people crave them. On the other hand, a drug that's effect is subtle, takes effect slowly, and lasts for a long time, is not particularly addictive. You might have heard that alcoholics and addicts are attempting to self-medicate. And that's largely true, because the drugs that people take to get high work on the same neurotransmitters as the drugs a doctor might prescribe to help you feel better and stay sober. The neurotransmitters are the same. The difference is in how the drugs work on those neurotransmitters. Fast, hard, and short-acting, or gradually, subtly, and long-lasting. Another way to think about it is that drugs of abuse tend to add an effect. A pleasurable one at first, but one that's way above and beyond what's normal. That effect diminishes as the person develops a tolerance for it, but in the beginning, a drug of abuse adds an effect that otherwise wouldn't be there. A typical psych med, on the other hand, doesn't add a new feeling, it removes a negative feeling, like anxiety, depression, anger, mania, so you can get back to daily living without the drug adding any additional effects. What about side effects? That's an additional effect, you might say. Well, you're right. Every drug has side effects, but the side effects of psych meds, even if they're a little unpleasant at first, are a lot more tolerable than the negative emotions they're relieving. And the side effects of not treating your depression aren't just unpleasant. They can blow up your life. So, to summarize, depending on a medication to stay healthy and sober is not the same as being dependent on a substance that ends up costing you everything. I hope that clears up whether you've traded one addiction for another when you started taking your psych meds. I'm really glad you asked that question, because it's a misconception that keeps so many people from getting the help that they need. The last part of your question. Just because I started taking psych meds, does that mean I'm going to have to be on them for the rest of my life? Well, again, let me remind you that I'm not a medical doctor and that this is not specific advice for you or anybody who's watching. Talk to your prescriber if you've got specific questions about your meds, and never make any med changes on your own. That said, though, I will give you just kind of a general response. Do people have to take psych meds for the rest of their lives? Maybe, but maybe not. But that's true for lots of meds, not just psych meds. Let's say somebody gets type 2 diabetes and they need insulin for a while. It's possible that if they lose weight, change their diet, get more exercise, their doctor might say they don't need to take insulin anymore. If so, that is wonderful. But they're not better than somebody whose diabetes doesn't respond to diet and exercise. That person might need to be on insulin the rest of their lives. I'm sure they'd rather not if they didn't have to. But there's nothing wrong with it inherently. Same thing with hypertension. Some people's blood pressure stays high no matter how much diet and exercise they get, and they end up taking meds the rest of their lives. It's not fun, but controlling blood pressure with diet and exercise isn't the good way of treating it, and treating it with meds is not the bad way. So, if a person needs meds long-term, they do. If they don't, they don't. Try this. We'll use the same analogy and just replace some of the terms. A depressed person might need antidepressants for a while, but it's possible that if they get counseling, therapy, work a 12-step program or something, their depression might respond well enough that they don't need the meds forever. It's great if it works out that way. But sometimes depression and other types of mental problems don't go away, no matter how much therapy or 12-step work you do. For them, psych meds become part of how they stay healthy. And there is nothing wrong with that. I think that's where your question's coming from. That somehow taking psych meds is shameful, embarrassing, a sign of weakness. It's not. I take 2 antidepressants every day, and I'm blessed to say that, along with having gotten my own therapy, I haven't had a really bad depressive spell in 15 years. As far as I'm concerned, you're not any more a failure or any more weak if you need psych meds than you are a failure or weak if you need insulin or an ACE inhibitor. You say your meds are helping you. Great. Be thankful and live your best life. It's possible that one day with counseling, your step work, and just getting your life back together, your doctor might agree that you don't need psych meds anymore. That would be great if it happened, but it's no crime if it doesn't. One word of warning, though. After a few weeks or months, a lot of people start feeling better, and they start to think to themselves, all right, I don't need these meds anymore, and they try to get off them. Be very careful if that happens to you. You might be feeling better because of the meds, and getting off of them too soon could just throw you right back into the mess you got out of. Again, never make any changes to your meds, no matter how you feel, without talking to your prescriber first. You might not have to be on meds the rest of your life, but most folks aren't ready to stop them the moment they start feeling better either. Thank you so much for a great question. I hope it gives you some new things to think about. Good luck in your recovery, okay? If you have something you'd like my perspective on, send me an email to DrBretsMailbag@gmail.com. I'd love to hear from you. In the meantime, check out my other videos, like and subscribe to this channel, leave comments below, and I'll see you again soon here in Dr. Bret's office.